Testing 1, 2. This is a prostate gland. The prostate gland is about the size of a walnut. As you age and get 55 and older, the gland itself may enlarge to about the size of a lemon. In some cases, it becomes Good afternoon, everybody. We're here today to talk over the prostate gland and prostate cancer. As you see in the diagram, the prostate cancer is just below the bladder. It's about the size of a walnut. That's that red area. In the bottom you see a normal prostate, and then on the right you'll see a cancerous where the tumor is actually showing. According to the Mayo Clinic, prostate cancer is the most common type of cancer in men. The prostate is a small walnut-shaped gland that produces seminal fluid that transports the sperm. Prostate cancer is generally slow-growing and remains confined to the prostate gland. A small percentage of these cancers are aggressive and spread quickly. Early detection is the key to successful treatment of the prostate cancer. Here are a few facts from cancer.gov. 30 million men suffer from a prostate condition that affects their quality of life. 50% of the men in their 60s and 90% in their 70s have symptoms of an enlarged prostate, or BPH. It's benign prostate hypertrophy. 230,000 of these diagnosed with prostate cancer, and 30% of those die. So remember, early detection is the key to successful treatment of prostate cancer. Here are a few facts from cancer.gov. 30 million men suffer from a prostate condition that affects their quality of life. 50% of men are in their 60s and 90% are in their 70s have symptoms of an enlarged prostate, or BPH, which is a benign prostate hypertrophy, or just enlargement of the prostate gland. 230,000 will be diagnosed with prostate cancer, and 30,000 will die from it. Prostatitis is inflammation of the prostate gland and can affect men of any age. There are a few risk factors that can indicate if an individual is at high risk. Age 40 or older with a positive family history of prostate cancer, if father, brother, or a close blood relative has had cancer, your risk double. African American men 40 years or older, incidence rate is twice as high as white males. Recognizing and diagnosing prostate cancer is the goal. If a man should test positive on his PSA, a prostate-specific antigen, the physician would order further tests to rule out other cancers, such as urinalysis, rules out prostatitis or BPH, imaging like MRIs, CAT scans to visualize the problems, a biopsy. Several tissue samples are taken from the prostate gland and sent to a lab to see if any cancer cells are among the tissue samples. Lymph node biopsies only taken if the cancer may have spread outside the prostate gland or is suspicious of the spread. In early stages, complete removal of the prostate gland may be indicated if the biopsies come back positive. The following are methods that may be used for the surgery. NSRRP, which is nerve-sparing retropubic prostatectomy. This can be possible to save the nerves that cause an erection while removing the gland. RPP is similar to NSRRP, but it is done laparoscopically through the abdomen and with a robot. The robot has several arms around the surgical table, with the doctor operating it from a console. This is a very precise method of surgery, especially when nerves are involved. This picture is showing the Da Vinci surgical system. As you can see, the physician on the stool, this space has got a console there that has hand controls to what operates the robot that's over the table. A nurse or a physician will be at the table with the patient to monitor the patient for any changes and to change tools on the robot. Another method is called RP, or radical prostatectomy. The surgeon removes the prostate and tissue surrounding it. Cancer is more advanced. Non-invasive forms of treatment, such as active surveillance. This method is an option if minimum number of cancer cells are noted and it is slow moving. It is what you see with close monitoring. So basically all you do is you diagnose there is minimum chances of damage at the time, and sometimes the patient will choose to watch and be monitored for several months before having any types of surgeries, or give them more time to think of what method of surgery they want to proceed with. Another method of non-invasive treatment is the radioactive seed placement. This is performed by a urologist, where he places radioactive seeds like pellets throughout the prostate, 80 to 120 pellets. This radioactive pellets are isolated in the gland itself, which protects it from the surrounding tissues from radiation. You don't have as much outside damage to cells. Another one is hormone treatments, which is a method that's being used and also in trials. Hormones are given to block the production of testosterone. Cancer feeds on this hormone, testosterone, and enables it to spread by blocking it. He's kind of looking at it as starving it. Cryosurgery is where they just go in there and they freeze the prostate gland using nitrogen, killing the cancer cells. Biggest thing we want to look at is prevention. Presently, scientists are researching and running trials on protective factors, which are foods, medicines, lifestyle changes that may help reduce the occurrence of prostate cancer. It comes down to it: if you're a smoker, stop, exercise regularly, eat a healthy diet high in fiber, drink lots of water, eat fruits. Cooked tomatoes are said to be a very good source of antibodies to fight prostate cancer. Have a physical exam each year and pay attention to what your body tells you. Prevention is what all of us need to be looking at, and presently scientists are researching and running trials on protective factors, which are foods, medications, and lifestyle changes that may reduce the occurrence of prostate cancer. If you're a smoker, stop. Exercise regularly, eat healthy diets high in fiber, low in red meats and fats, drink lots of water, eat fruits, and cooked tomatoes have shown promise in reduction of prostate cancer. Have a physical exam each year and pay attention to what your body says. I personally have gone through this myself. About 2 years ago, I had a prostatectomy with the one with the nerve-sparing robotic procedure. It started several years before that with a PSA that was on my exams, was showing elevation. Over the years, it began to elevate even more each year with the physical. Toward the year before I had the prostatectomy, you see I felt a lot of aching, which felt like a bladder infection or kidney infection in the back, aching through the back, the hips and the legs, just like we talked about earlier. Men don't have bladder infections as a rule, so most likely it's prostatitis. I was treated several times for this at different episodes, and then finally the elevation was high enough that my family doctor referred me to a radiologist and a urinologist. The urinologist decided that we needed to take biopsies of the prostate, which was done, and it's a little embarrassing and stuff, but they take several plugs out of the prostate, tissue samples, if you want to call it that, and send them off to the lab. When I got back, and it told me I had a stage 2, which is still of the slow-growing type cancer, which is was alarming to me. And with the options of radiation and hormones and also the surgery, I decided on picking on surgery just because of the risk factors. I'm 58 right now, so I figured if I did the wait and see or even radiation may kill the cancer for the now, but it does scarring damage to the tissues in the prostate and sometimes outside the prostate and the lymph nodes and the remaining organ tissues. This would result in more extreme type surgeries and treatments later on down the line if the cancer were to reappear. So I decided on the nerve-sparing prostatectomy so that my body functions and hormones and all that would stay intact if the procedure was successful, which it was. I pretty well went back to normal in sexual activity and urination problems or incontinence. You have to exercise the muscles, kind of like you're straining, to be able to stop the urine, because the prostate was a clamp in a way that did that. So you have to strengthen all that to prevent incontinence. And I appreciate everybody listening to this, and I hope it helps you. Thank you.